Thank you very much for joining our Toolbox talk this morning, guys. We really appreciate you taking the time out on a Tuesday morning to listen into this. Now, the new hazardous chemical agents regulations came out last year, went into draft format, went into comment for obviously everybody out in the industry. A lot of people were commenting on it. The National Institute of Occupational Health, as well as SIOSH, everyone got together. There's been a lot of talk around the hazardous chemical agents regulations of 2020, and it has now officially gone out. It is there. It is a legal requirement for us to ensure that we adhere to these regulations, especially if it falls part of your scope of work. Now, we know this doesn't affect every single plumber out there. It depends on where you're working and what you're working with, but it is a good idea for us to keep updated with what regulations change constantly. Currently, there's the new OHS bill. It's the Occupational Health and Safety Act that is being amended, and this bill is also going to come into effect very soon. So all these changes, all these regulations might not affect you directly, but down the line, as you perhaps get better in what you are doing and you maybe branch off into different aspects within construction, perhaps this hazardous chemical agents regulations will affect you. But if you are just staying in your current scope and it doesn't affect you, it would still be good for you to listen to this Toolbox talk, because most regulations that do affect you are constantly being amended. This could be because there are safer ways to keep our employees safe and free from illness in the working environment. But at the same time, it also shows a huge initiative from our government in always pushing forward a higher standard of health and safety for our sites, and especially the people on our sites. We must remember that health and safety is not just about paperwork and documents. It's about people and teamwork. And that's really what we are trying to achieve with all of you that listen in. Many of you safety specialists and many of you plumbers out there in the industry that have spoken to us in the past about what you want to hear. And so we are just going to give you a quick, brief rundown of what the hazardous chemical agents regulations of 2020 has in store for you. Now, exposure of employees to agents that are hazardous to health should be prevented, or where this is not reasonably practical, you need to adequately control that exposure. So if we can, at all possibility, we always want to try and eliminate the risk. That is our goal. That is our target. Which means if you are currently working with some sort of hazardous chemical agent, could you find something that is a lot safer to work with and then change it for that? If that is a possibility, well, then you are taking the risk of working with a hazardous chemical agent and you are replacing it with something else, perhaps not a hazardous chemical substance, but something more safe for the employee to work with. Now, obviously, this is not always practical. We want to be reasonable with health and safety as well. We cannot just demand of every person to do it exactly the same way. And so there's leniency for all of you owners of businesses. You are going to look for the most practical way to adequately control it. And please remember, when we say control, adequate is extremely important to go behind that word. We want to ensure that it is effective control measures. Now, this fundamental requirement from the new regulations for hazardous chemical agents that were brought about in 2020 is going to assist you in doing this. This is because exposure can occur by inhalation, ingestion, or absorption through the skin, but inhalation is usually the main route of entry into the body. Now, if you need a copy of this or if you want to download it, we can either email it to you or you can just go to the Department of Labor's website and you can download this latest regulation. It is also on the Toolbox Talk Dropbox. If you want it there under latest regulations, you can go and find it there for yourself. And if you'd like, just take a look at table 2 and 3 of Annexure 2. And this is going to list your occupational exposure levels, or your OELs, your occupational exposure levels, which should be used in determining the adequacy of control of exposure by inhalation as required by these regulations. So please do yourself a favor and go through the entire regulation in a little bit more detail compared to what we are doing today. This is just an introduction to it. But really, we want to ask you to please spend a little bit of time looking at some very, very important aspects of this regulation. The advice in this document should be taken in the context of the requirements of all the regulations, especially though looking at Regulation 5. This is the assessment of your exposure, which means if you are using hazardous chemical agents, you need to assess the actual level of exposure to your employees. Then this would naturally follow under Regulation 10, controlling that exposure. So another very, very important regulation or part of this regulation that you must read. Regulation 12 and 6, also very vital for all the plumbers, the maintenance of control measures. So you've assessed it, you've controlled it, but now we need to maintain those control measures, keeping them effective. And one of the things that may need to be a part of a control measure is air monitoring, as we see in Regulation 6. So please go through this. If you are not too sure which agents are hazardous, these are all defined in Regulation 1. Now, there is a separate legislation for lead and asbestos, and these agents are not covered in detail in this document. You will see it in some of the annexures or in some of the tables. It does specifically speak about asbestos and lead, but it does not go into detail about this because we already have two other regulations that cover it in more detail. So if you are working with asbestos, if you're an asbestos remover, or perhaps you get to a site where a part of your job requires you to work with asbestos, please ensure that you look at the asbestos regulations. Again, the same with lead. If you are working with lead, please ensure you look at the lead regulations, as it is not fully covered in these. So this document also does not apply to exposure below ground in mines or exposure to hazardous biological agents. That is going to be a toolbox talk that we will come up with next month. So please be on the lookout for that, as all plumbers are exposed to biological agents all the time. We've had toolbox talks on this before, and we are going to remind you of the hazardous biological agents regulations for you as plumbers in the industry. So adequate control of exposure when prevention is not reasonably practical should be achieved by one or more of a range of control measures as described in Regulation 10. Remember, we mentioned these are control of exposure to hazardous chemical agents. So please ensure that it's not just protective equipment. As you can see, control by personal protective equipment should be applied only when other means are not reasonably practical. So again, this is not just a copy and paste type of thing where if you're working with it, we just put a whole lot of PPE on the person to stop the direct exposure. What we want to achieve is a very good assessment of how effectively we are going to prevent exposure first. Should exposure happen, that's when we take the next step to really see how we can prevent it either from happening again, as well as the emergency situations that we might need to follow. So let's take you through just two sections. We're just going to discuss two sections very briefly this morning. That's Section 3 and Section 4. Section 3 is information, instruction, and training. Now, any employer who obviously undertakes to work with hazardous chemical agents must, before any employee is exposed or may be exposed, as well as after consultation with the Health and Safety Committee, and this should obviously include not just the Health and Safety Committee members themselves, but also perhaps members of your workforce. Really try and get all of your employees involved. What are you supposed to do as an employer before you expose any individual to the possibility of exposure? It's to provide that employee with suitable and sufficient information, instruction, and training, as well as after that, continue to inform, instruct, and train that employee at intervals as may be recommended by the Health and Safety Committee. Now, when we've discussed health and safety committees in the past, many plumbers have said, well, we do not have a health and safety committee. We don't fall into that category of Section 19 and 20 of the OSH Act. Well, why not set up a committee in any case? Does it have to be the exactly same one as the section 19 and 20 of the RSHAC? No, not at all. But learn from the principles of that. Design one that is bespoke to your company, that is tailor-made to you as an employer. And then use that committee by including those with more knowledge, more technical skills, more understanding, and make it more practical for the employee himself. Now, continuing with section 3.2, what is this information? What must it include with regards to these regulations for hazardous chemical agents? Well, the information must be on the chemical substance that is in place. Obviously, you will then discuss these regulations. You can discuss the legislated occupational exposure levels that are in place. You can then also discuss the duties of the person who is likely to be exposed. And this would be specifically the employee that you're training. And discuss with them Regulation 4, which we'll touch base on in a minute. You also want to discuss the details of the hazardous chemical agent to which the employee is likely to be exposed. Now, this is very important. We don't want to have a huge training session with employees on chemicals that they are not going to be using. So we don't want to take the regulations and make it too general. Excuse me. So we don't want to send them to a CETA accredited company to get trained on hazardous chemical agents, and yet they are not being told what specific chemicals they are working with. So please remember, we want to discuss with them the exact chemical that they are going to be exposed to. And what would this include? The name of the hazardous chemical agent, where it's going to be found and located in the workplace, the information of the harmfulness of this. So what is the consequences of either inhaling it, having it touch your skin, or having it penetrate the body in some other form? Then any significant findings from your exposure assessment. Remember, a very, very important part in Regulation 5, looking at that assessment of exposure. And I just want to re-emphasize this. You must be able to do a proper assessment on how people can be exposed and then notify the employee of these findings. Also, information on how to access the relevant SDS. This is your safety data sheet. In other words, the safety data sheet is going to help us to understand the chemical we're working with, what are the first aid measures, should we be exposed to it, and then what are the recommended guidelines from these manufacturers on the types of personal protective equipment we should be using and how we should be using it, as well as the information that each part of the label, as well as the labels on the containers rather, that provides with information. All of this information should be discussed with the employee. Now, when we say discussed, we are talking about sitting with the employee, taking the actual chemical, having the SDS, having your own, as you see there, subsection F, work practices and procedures that must be followed, and going through an actual training session with the employee, not just handing over the documents, handing over a safety file with all this information and saying, well, now it's up to you. You work with it, so you are responsible to understand it. Please take the time. Remember, it is an obligation to the employer to ensure information is given, instruction is given, as well as training is given. Now, this can obviously be delegated to other people. That's understandable, but find people that are competent in what they are going to be training first. So these toolbox talks are great. It's a great way for your employees to be notified or be instructed, or to provide some sort of continual professional development through training. But we still want to have our own internal training. Now, what we are going to be doing with IOPSA, and just as a side note, we are going to be developing a little bit more online training sessions that can be done through your cell phone. This can be done during any time of the day. Some of you plumbers wake up at 2:00 in the morning and wonder what to do, and you want to do some extra stuff. And so we are busy designing this, and we'd, like your input on what type of training would you like to see from us. One of the first things that we are going to be doing is safety files. where we take you through the index as well as then every part of that index. What is a policy? What is a health and safety plan? What is a risk assessment? And these little small courses, 5 to 15 minutes, are then going to be uploaded. You will be able to download it to your phone, to your cell phone, to WhatsApp, or however you're going to be doing it. You can then listen to the program, answer a few questions, and then you can be given just a little attendance certificate. It's not going to be a competency certificate, but it's just going to be for continual professional development. So if you'd like to see some more information out there, please get in touch with us if you'd like to see something specific from your side. Then also the necessity of personal air sampling or biological monitoring, as well as medical surveillance. Now, this is all part of training. We need to train them as to why this is important. So not just the what, we're not just giving them the legislation and say, what does the law require? We are saying what the law requires and why it is necessary for it. Remember, it's really to prevent them from being injured. We want to protect their lives. Then also the need for engineering controls. Now, this comes back to your control measures that you've put in place. And so not just going through the chemical itself, but going through all the control measures that are being put in place by you as a company. What are the engineering controls? You'll see the next one, the need for personal protective equipment, including why respiratory protective equipment? Because the majority of times people are being injured is through inhalation of these hazardous chemical agents. And so to protect ourselves, we want to know, how do we protect our respiratory tract and what types of PPE is important? Now, we can't just use a normal dust mask or your normal COVID masks to protect ourselves from certain hazardous chemical agents. You see, we're going to need actual respiratory protective equipment. And so a little bit of research has to go into this to find out what type of respiratory protection do you actually need. Now, we are working in conjunction with Pinar Brothers PPE company. We're going to be discussing with them the best types of respiratory protection for hazardous chemical agents, and we will send you some more information on that as soon as they get back to us with the products that they have. And we have requested, please, it is still during COVID, if we can put it that way. It's not after COVID. People are still battling with financial things. So if they can look at cheap ones, medium range ones, and a little bit more expensive ones for all varieties of companies, those who cannot invest so much into it, we want to be reasonable and practical for you as well. Then also the precautions that must be taken by the employee. And this comes back down to what we discussed earlier, the workplace procedures that has to be in place. Again, we will obviously design safe working procedures for you. We will design these templates for you in the coming months, but please don't just copy and paste them. It is a template from us. We do want to do as much to assist you, but you need to do something with those documents as well. You need to take those precautions and make them more personal to your company. Then also the necessity, correct use, maintenance of the safety equipment, facilities, as well as the engineering controls that are provided. Again, this is all part of your training and instruction. Then you must, as an employer, give written instructions of the procedures to be followed in the event of an emergency situation. This can be spillages and leakages or any similar emergency situation, specifically to the drivers of vehicles transporting hazardous chemical agents. We do not want you to face a traffic incident where you are carrying or transporting these types of hazardous chemical agents. It has a spill or you have a leak, and then you expose other road users or other potential people that are coming to assist you on site to this danger. And that will include obviously all the signage, training, and information that goes along with that as well. Now, the last part of Section 3 is as contemplated in the Occupational Health and Safety Act, Section 37.2. Remember, this is discussions with a mandatory person. A mandatory and yourself must agree in writing to the arrangements and procedures between yourselves to ensure compliance with this information. So please include this now in your mandatory 37.2 agreement, just as we've done with ergonomics regulations, just as we've done with the new hazardous biological agents, just as we're going to do with the new OHS bill. We're going to constantly take our documentation and update it to the latest regulations. So if you have a contractor working for you, please ensure that you include this information into that mandatory agreement. So as we mentioned, that was section 3. Let's quickly look over section 4. It's a very short section. Basically, it's the duties of the person who may be exposed to these hazardous chemical agents. So if you are the employee who's going to be trained or going to be using these types of chemical agents, please remember these are the duties that you must implement. Every person who is or may be exposed to a hazardous chemical agent must obey a lawful instruction given by or on behalf of the employer or self-employed person in regard to the hazardous chemical agent release prevention. We never want to expose any person, including ourselves, to this very hazardous chemical. We also want to ensure the wearing of personal protective equipment. It's one thing to have it, it's another thing to use it and use it correctly. Then the wearing of monitoring equipment to measure our personal exposure when exposure levels may be higher. Reporting for health evaluations and biological tests as may be required. And this could be your medical surveillance that you are going to be putting in place. The cleaning up and disposal of materials containing a hazardous chemical agent. So if we do spill some or we clean, and while we're working, we clean up the area around us, please, we don't want to throw that in general rubbish. We need to know how to dispose of these materials correctly. And this is going to go into your environmental management plan, as well as your waste management plan that is included in your health and safety plan, as well as the housekeeping at the workplace, your personal hygiene, and the environmental and health practices, as well as information, instruction, and training, as we've just spoken about in section 3 or regulation 3 of these hazardous chemical agents regulations. So we hope you enjoyed that very brief introduction to the new hazardous chemical agents. So thank you very much. We look forward to joining you next week.